This is Dr. Reddy from Seven Oaks Pet Hospital. Hello, this is Dr. Reddy from Seven Oaks Pet Hospital. Again, this is Thursday, the February 18th. I'm here for Facebook Live today. We'll be talking about teeth cleaning in dogs and cats today, which a lot of the clients have been requesting me for a long time, and I did it, I think, over last year maybe sometimes, and I know dental tartar and calculus is a very commonly seen problem in pets, and that's why we wanted to make sure that we cover that topic today. And plus, the most important thing is the February obviously is the pet dental month. We all try to do as much education as possible as we celebrate February is a pet dental month. So I got some material with me. I will talk about that as well, the periodontal disease in dogs, and you'll be shocked or surprised to hear that 85% of adult pets over the age of 2 have some kind of a periodontal disease. Either it's grade 1, or it's grade 2, or it's grade 3, or it's grade 4. Majority of the time it'll be grade 1 and 2. So that's something I just wanted to let you know. 85% of adult pets have some type of a periodontal disease. So just wanted to bring it up. Again, I'm trying to see here how I can enlarge my screen, but I don't know, I can't. Anyway, we'll stick with that. Behind, actually, when you see on the door in our clinic, we keep pretty much on every back side of the door, you can see here. I don't know if you can see here closely. And that's a chart. We talk about stage 1, stage 2, stage 3, stage 4, which talks about the beginning of the periodontal disease, early periodontal disease, moderate and severe periodontal disease. So it talks about different stages of the disease. So when clients are actually sitting in the exam room here, they would be able to pretty much compare and see what stage their pet is at. So when we're talking about the dental disease, like in humans, dogs, we recommend at least once or twice a year, depending on the breed, to get their teeth scaled and polished. And as we all know, if we have a periodontal disease, there is definitely going to be an underlying conditions with liver, kidney, and heart could get affected, because the bacteria from the mouth travels through the bloodstream and can enter into different organs, and that can damage the other organs. And that is known fact for humans on the human side too. And that's why it's very important to get their teeth cleaned as often as possible. And the best recommended teeth cleaning is under general anesthesia, which is we have to put the pet under general anesthesia. Then we can nicely clean, do the deep scaling, and then polish the teeth. And then we do recommend doing dental x-rays too, which is something it's very important, because a lot of times when we are looking from outside, the teeth might look fine, but then they could have an abscess. So dental x-rays are another important part of the whole dental cleaning protocol. And dental x-rays, unfortunately, we can only do while they're under general anesthesia. We are not able to do it if they're awake. So that's another important part of the dental scaling. And we use an ultrasonic scaler and polisher we have in the clinic, which is a very high-speed one. So definitely we recommend using that ultrasonic scaler and polisher in order to clean the teeth. And we do have a high-speed drill, same thing like what we have on the human side if we need to do any extractions or anything. The advantage of the machine we have, which is exactly looks like the human side with a compressor and everything, It sounds like the human dental machine too. When you go to your dentist, it makes that squishy noises, the air coming out and other things too, which is compressor part of it. And the advantage of that machine is the pets don't have to be under anesthesia for too long, unlike other machines which are not high-speed ones where it takes longer to get the tartar and calculus out, where it takes longer to extract the teeth. Our machine is, as I say, it's a high-speed machine which takes probably 5-10 minutes at the most to polish and clean the teeth. And if it need extractions, they are pretty quick and fast extractions we can do with that machine. So the advantage is they don't have to stay under anesthesia for too long. So that's the beauty of this machine, though these machines are pretty expensive, but that gives a nice tool for our doctors when they are cleaning the teeth or extracting the tooth or so. And then we have a dental digital x-rays. Again, same thing. It's a great piece of equipment. It's a digital. We take a quick picture of the tooth which needs to be extracted, and then look it into the computer and see, what if there's any abscess or if it needs an extraction or if we can save the teeth. Again, we want to save as many teeth as possible. That's our goal, and clean them. But there are situations where we can't, and we might have to extract that tooth, and that would be the best interest of the pet and pet owner. Then we make the decision together with the pet owner and then go from there. And then we will talk about a process called anesthesia-free teeth cleaning, which we have been doing at 7 Oaks since 2009. It's not recommended for every pet which walks into our door. I recommend for pets which are at grade 1 or stage 1 gingivitis, like I have a chart here. So this is where the canine stage 1 is, and this is where the feline stage 1 is. So that's where only, there are more stages we don't recommend for rest of the stages. That's just for the stage 1 and maybe stage 2 in between. Again, doctors will do an exam before we recommending that anesthesia-free teeth cleaning. And anesthesia-free teeth cleaning is also done with the ultrasonic scaler and polisher. But again, those are not high-speed ones. They're regular dental scaler polishers. So yes, we can clean the teeth, but if you compare with the regular anesthetic procedure, that's always the best. If owners can take the risk of anesthesia and dogs are okay to put under anesthesia, that is what I would recommend. But if owners are concerned and owners had some bad experiences in the past, whatever the reason could be, and they just want anesthesia-free, anesthesia-free is better than not getting any dental care for pets. Let's put it that way. So that's why we offer that procedure, and people like it. I got a few comments here. Lupe, how often are dental recommended? At least I would say once a year, and some breeds we have to do twice a year. When we say twice a year, there are some smaller breeds which needs twice a year. Like you'll be surprised to see or hear about Dachshunds are the #1 breed which has bad teeth. So those dogs would definitely need, I would say, twice a year, because they tend not to chew on things, and that's how it gets a lot of tartar and calcium deposited on the teeth. So, and Yorkies, the smaller the breed, I think more often they have teeth issues and teeth infections. So we have to recommend to do the dental more often. The larger dogs, sometimes they can get away with once a year teeth cleaning, because they tend to chew on it, they tend to play with balls and all that stuff. So Katie asked me, what is the importance of dental x-rays? Yep, that's a great question. As I was talking about dental x-rays, a lot of times when you're looking at a tooth from outside, you might not see what is happening inside the tooth. If they have an abscess, if they have a infection, or if they have a fractures, which we may not be able to see, because dogs sometimes bite on these bones, and the fracture can be inside the gum line or on the jaw. From outside we don't see it, and dog could be painful, they may not want to eat it, they don't tell us what is wrong with it, and you'll be surprised how often we found these issues, dental abscesses, dental tooth fractures, or root issues, having a root problems, or sometimes even jawline fractures too. We find in some dogs where owners don't have no clue and dogs are chattering their jaws, and we don't know. So until we do the x-rays, we won't know it. So that's the reason we recommend dental x-rays, and that's the importance of the dental x-rays. And is anesthesia anesthesia free less expensive? Yes, absolutely. Anesthesia free teeth cleaning is less expensive than regular dental, as we don't use any medications to sedate or anesthetize the dog. So that is why anesthesia free would be, I mean, $10-15 less than the regular. We routinely discount our dentals hugely by almost 50% than our regular procedures, because we want to promote dental health, oral health in pets, and we want people to come and get their dogs' teeth cleaned. So those are heavily discounted packages we have. And price range, Sandhya asked me what is the price range for dentals. Price range is anywhere from 225 it starts, and it could go up to 275 to 300 depending on the size of the pet. That's only for cleaning, and includes anesthesia, and also includes complete blood work, includes fluids, includes monitoring EKG, blood pressure, and all that stuff. So it's a package price. It's not like a simple teeth cleaning price, and then we don't add anything else on top. But if it needs blood work, I mean, if it needs extractions, or if it needs any x-rays, that would be extra. And we have kept it very competitively, those prices, from 225 to 300, and we have not increased those prices for a long time at Seven Oaks, because we are promoting teeth cleaning, oral health, dental cleaning. So, and at this point, we are giving some discounts for dental procedures right now. I think it's on our Facebook and on our website. If I'm not wrong, again, folks, correct me. I think it starts anywhere around $50 for procedure, I'm thinking. So it's a great time to get that $50 off of the procedure during this month, and until end of this month we have to do the teeth cleaning. So please avail that extra special price. Alyssa asked me, how do you keep pets comfortable and content during anesthesia-free cleanings? Anesthesia teeth-free cleanings. All right. Yeah, that's a great question, Alyssa. Like I said, not every dog is a great candidate for anesthesia-free teeth cleaning. We pick and choose. Obviously, number one thing is it has to be only stage 1 or grade 1 dental, where they're not painful when we are cleaning the teeth. Number 2, their demeanor is very important too. We have to make sure that they're quiet and calm, and they're not hyper dogs. So a lot of dogs, I mean, I would say 80% of the dogs which come for anesthesia-free teeth-free cleaning, they do get that procedure, but there's a 20% of those dogs which may not be the candidates. We feel like they're too hyper, or they can't tolerate that dental scalers, buzzing in their mouth, or sometimes they have too much tartar and calculus. Then we definitely decline those dogs, and tell them it's in the best interest of the dog to get a regular teeth cleaning. And again, I know people have issues because of anesthesia, but 10 years ago, anesthesia was completely different than what the anesthesia protocols we have today. It's a lot more better, and knock on the wood, we don't have any anesthesia related deaths while dogs are getting teeth cleaning or extractions, because they are monitored well. They are hooked up to, like I said, EKG, pulse ox, blood pressures, and we do a complete blood work. It's a 17 panel blood work they get. So we make sure that they're healthy enough to go under anesthesia. And a lot of times, again, you'll be surprised, while we are doing these blood works and we see some issues, we call the client and postpone that procedure because we saw something, a liver increase or a kidney enzyme increase in the blood work, and we try to fix those problems. And that's another advantage, is that we would be able to find hidden problems when they come in for teeth cleaning while we are running a blood work. So that is another great thing about getting a teeth cleaning done. And we try to take every precaution as possible before we put that pet under anesthesia. So I just want to let you guys know that we just don't put every dog which comes into our doors under anesthesia. And Lupe asks, do you have any at-home day-to-day dental cleaning recommendations? Yes, I mean, there are a lot of teeth cleaning recommendations we have, especially there's special diets available. Royal Canin has an oral care diet, Science Diet has a TD diet, And that's another great point. What you can do with your dogs is you can add that as a supplement, or you can just feed as a complete food, and they are 100% nutritious foods. And what that food does is when the dog bites on those big kibbles, they're pretty big size kibbles. When they bite, that kibble acts like a brush. So and also it chelates all the calcium and everything from saliva. So it minimizes the deposition of calcium or any other tartar buildup on the teeth. So if the dog was on a regular food and hasn't had any oral care like brushing at home or oral rinsing gels, or there are some oral chews available, I like it, and my dog loves this called um, Orvet chew, which we keep it here, which we sell here. I'm going to pull up a brochure. Yep. And this is the Orvet chew, and that's pretty good chew. Once a day we recommend. And I've had dogs where people decline to do the dentals for some reason, and I started them on this Orvet chew and asked them to take a picture a month before they started this, and a couple months later take another picture and compare it, and they have seen at least 50% improvement with the dog's tartar and calculus disappearing and gums looking better with this chew, because this chew has an ingredient which actually human dentists have been using for people's mouth oral care. So that is what actually helps keep that mouth fresh when the dogs chew on this Orvet. And dogs love the Orvet. And the other beauty is, even if the dog ingests the complete Orvet, it dissolves in the stomach. So they don't have to worry about any obstruction or anything. Like if you remember, a long time greenies were causing a lot of issues 10 years ago, where dogs were chewing and ingesting and causing obstruction. So that is about the oral care. And then we covered about oral rinsing gel, brushings, oral diet, and then teeth cleaning, teeth oral x-rays. I think we covered pretty much everything, looks like. So again, try to remember our discounts. This month we are offering $50 on our regular procedures for teeth cleanings. So please call us and or make online appointment if your dog, or if you're looking for a teeth cleaning appointment. And also we do have wellness plans which offer teeth cleanings, which is our wellness plan Gold. Actually, you'll be surprised when you sign up on a wellness plan Gold, you are only paying $120 for their teeth cleaning. That's how much discounted the wellness plans are. So the wellness plan Gold covers all the vaccines and the teeth cleaning they get, and they get one extra blood work too. So which is another advantage. So when you break that apart, you're only paying $120 for teeth cleaning, which is a lot cheaper than any non-profit organizations can offer you a teeth cleaning to the quality of teeth cleaning service we do here. You know what I'm saying? We don't have 10, 15, 20 dentals doing on a daily basis. We cap our dentals, 3 or 4 a day, so that they get a complete focus on them, and a technician is watching, a doctor is watching this while the teeth cleaning has been done. And then the last thing I forgot to mention, every dog goes home a picture we take before we clean the teeth and a picture after we clean the teeth, so clients can see the difference, how much the teeth cleaning was done. So that is about the teeth cleaning at Seven Oaks Pet Hospital. And again, hopefully you guys can take advantage of our special promo we are running until end of this month. It will be $50 off our regularly lower prices of our dental. So please take advantage and call us or email us anytime, or on Facebook you can message us. And please give me your feedback, what you guys think about this video also as well, plus any other topics you guys want me to cover. Next week I'll be back at same time, 12 noon Thursdays. And oh, I have another question. Do pocket pets need their teeth cleaned? Absolutely. Rabbits does need teeth cleaning. I think rabbits are the only ones have teeth issues, and guinea pigs do. They have, their teeth grow. Rabbits and guinea pigs, I don't know if you guys know, their teeth grow as they get older. So you have to trim their teeth all the time. Unlike in people, it's a different case, or a dog or a cat, but rabbits and guinea pigs, their incisors, they keep growing, so you have to keep trimming them. Yes, absolutely, they would need teeth cleaning too. And not many pets come in for teeth cleaning, but unless they have a huge tooth infection or teeth abscess or fractured tooth. But on a routine basis, not many people bring those pets, unfortunately. But that was a great question, Emily. All right. Thank you guys for joining today. I really appreciate your time and hope to see you next week. Thank you and goodbye.